At BioXcellerator, we treat patients with juvenile rheumatoid arthritis, or JRA. This is an autoimmune disease that causes inflammation in the joints or arthritis in children. While some children may outgrow certain forms of JRA, the chronic pain, stiffness, and loss of flexibility can affect bone development and growth. Extra-articular manifestations of the disease can occur in heart, liver, spleen, eyes, and lymph nodes. As the inflammation becomes chronic, daily life becomes more difficult, as school, sports, nutrition, and sleeping can all be affected by JRA. Medications such as NSAIDs, immunosuppressants, and local injections may relieve symptoms but don't cure the disease. Reducing activity due to the pain can contribute to the onset of other conditions, obesity, and mental health disorders, because pain leads to a more sedentary, isolated lifestyle. Advanced cell therapy offers new hope to some patients when standard treatments such as medications and injections may only provide temporary relief or no relief at all. Research shows that mesenchymal stem cells derived from umbilical cord tissue through intravenous and intra-articular application, in combination with a holistic approach to treatment, can reduce systemic and local inflammation, repair, rejuvenate, and regenerate damaged cells, and improve pain and function of the affected joints. At BioXcellerator, we know that the best therapy begins with the best cells. Signature cells are produced in our own lab from mesenchymal stem cells derived from Wharton's jelly umbilical cord tissue. Based on our proprietary protocols, these cells are cultured and expanded and tested to make sure they meet high standards for purity and potency, and can offer high levels of anti-inflammatory properties, the best potential to modulate your immune system, and more potential to stimulate healing. Don't let your child settle for a life filled with pain. Learn how cell therapy can help reduce pain without long-term medications or joint injections.